Hello everyone. In this video, we are going to discuss about anatomy of hip joint, which includes its articular surface, ligaments, movements occurring in the hip joint, along with the blood supply and nerve supply of hip joint. Hip joint is one of the largest ball and socket type of multi-axial synovial joint in our body. This is because of the reciprocal articular surface of the head of femur and the acetabular cavity. Hip joint produce the similar movement possible in the shoulder joint, all the varieties, because of the long and narrow neck of the femur and the neck shaft angle. So this acting like a shroud so that the lower limb is freely mobile by clearing the hip. If we take the relationship between the stability and the range of movement, both are maintained in the hip joint. So here all the movements are possible similar to the shoulder joint, but because of the stability, here the range of movement is limited when compared to the shoulder joint. So when we see the articular surface of the hip joint, in the femur, the head of the femur is completely articular except the fovea, which is a small dip in the head of the femur. So the head of the femur is almost 3/4 of the complete spear, which is covered by the hyaline cartilage, that is the articular cartilage. And here in the acetabulum is actually having the lunar articular surface, that is the horseshoe shaped articular surface, along with the acetabular fossa filled with the fat. Then acetabular notch is there, which is bridged by the transverse acetabular ligament. Here you can able to see this is the notch, and here the acetabular fossa where the head of the femur will locate, and this is the horseshoe shape or the lunar shaped articular surface covered by the hyaline cartilage. So only this part is the articular in the acetabulum. And you can able to appreciate the acetabular labrum, which is homologous to the glenoid labrum of the shoulder joint, which is encircling throughout the horseshoe shaped articular surface, which increase the depth of the acetabular fossa, that enabling the more stability to this joint. Moving to the ligaments of hip joint, first we'll start with the capsular ligament, otherwise known as joint capsule, which is an outer covering of any synovial joint. So if we see the attachment of capsular ligament, anteriorly in the femur, it is attaching to the intertrochanteric line, that is in the line extending from the greater trochanter to the lesser trochanter. Same in the posterior aspect, it attaches 1 centimeter medial, otherwise in front of the intertrochanteric crust. If we see the attachment in close to the acetabulum, which is around 5 millimeter away from the margin of the acetabulum, just outer to the attachment of acetabular labrum or the transverse acetabular ligament. The whole joint capsule, which is thicker in the anterosuperior surface and loose in the postero-inferior surface, because this antero-inferior surface is the region which is prone to expose for the stress in the during the movements. And if we see the fibers arrangement in the joint capsule, these are two sets of fiber, that is the circular and the transverse fiber. These circular fibers are the inner fiber which doesn't have much bony attachment, as these fibers forming a circular arrangement and which is more thicker in the region of the neck of the femur, that is around the neck of the femur. It thickened to form a zona orbicularis, that is the inner set of fiber, and the outer set of longitudinal fibers, when it attaches to the intertrochanteric line, it forms the retinacular fiber. Inside that, the retinacular vessels will pass to supply the most of the head and the neck of the femur. And if we see the attachment, this is attaching just close to the acetabular labrum as I already said, and inferiorly attaching with the transverse acetabular ligament. Just inside the joint capsule, in all the synovial joint, there is a synovial membrane. So, which covers the inner surface of the joint capsule and also the structures, ligaments which is within the joint. So that includes the acetabular labrum and the transverse acetabular ligament. Here the acetabular pad of fat and the ligament of head of femur. Coming to the iliofemoral ligament or the ligament of Bigelow, which is one of the strongest ligament in our body. This ligament is having the inverted Y shape arrangement. So this is the inverted Y shape arrangement of the iliofemoral ligament. As the name indicates, it attaching from the ilium. Okay, it's attaching from the ilium to the femur. So this iliofemoral ligament has the base and the apex. This is the base and here the apex. So apex is towards the anterior inferior iliac spine. So this is the inferior part of the anterior inferior iliac spine, and it also get attachment from the region which is in between the anterior inferior iliac spine and the acetabulum. So from here it takes origin and it has the two attachment in the base that is extending over the intertrochanteric line, which is blending with the joint capsule of the hip joint. So this has the three set of fiber. Two are thick, that is the lateral thick fiber which is obliquely running fibers, and medial thick fiber which is the vertically running fiber in between central loose thin portion of the ligament is there. So as I already said, this is one of the strongest ligament of our body. They are saying this ligament prevents us from bending backwards. Okay, so this ligament, that is the iliofemoral ligament, prevent us falling backward. So it holds the whole weight of our trunk. Then moving to the pubofemoral ligament. So as the name indicate, it starts from the pubis to the femur. So again this is a triangular ligament which has the base towards the pubis, unlike the iliofemoral where the base is towards the femur. So here the base is attaching to the iliopubic eminence and the iliopubic ramus also. Then from there the apex is extending to the antero-inferior region of the joint capsule of the femur, which supports this antero-inferior region, and its apex is blended with the medial thick band of the iliofemoral ligament. Then the third ligament, that is the ischiofemoral ligament. This is one of the weak ligament when compared with these three. So this supports the hip joint from the posterior aspect. So it attaches to just posterior to the acetabular margin of the ischium. From there, this ligament spirals around and attaches just deep to in the deeper part of the greater trochanter, just deep to the iliofemoral ligament. So all these three ligaments, that is the iliofemoral, ischiofemoral and pubofemoral, takes attachments from the three different part of the hip bone and blended with the capsular ligament of the hip joint, so that it strengthen the capsular ligament of the hip joint and attaching to the femur. Next is the round ligament of head of femur, which is otherwise known as ligamentum teres femoris. So which is actually the triangular ligament which extending from the apex is extending from the fovea of the head of the femur, and the base is up to the transverse acetabular ligament. This is not the ligament which increases the stability of the hip joint. Instead, it allows the transmission of the artery to the head of the femur. Morphologically, this is actually derived from the capsular ligament, but which is placed within the hip joint. So this is completely lined by the synovial membrane. Then one more thing for the ligament is the acetabular labrum, which is also considered as a ligamentous structure, but which is just forming a triangular like impression around the acetabulum. That is the articular surface of the acetabulum in the horseshoe manner. So it is deficit in the inferior aspect, which is bridged by the transverse acetabular ligament. If we see the acetabular labrum, which not only increasing the depth but also it helps in grabbing the head of the femur, that increases the stability. And the transverse acetabular ligament, you all know, with just bridging the gap in the acetabular labrum and the this horseshoe shaped articular surface of the acetabulum. Moving to the relation of hip joint, this is the most important part you may need to draw in your exam point of view if it comes as a essay question. So if you look the diagram together, it is a bit complicated. So we'll divide it into bits and pieces, then we'll try to complete the diagram. So this is actually the capsular ligament with the synovial membrane. So first we'll start with the posterior aspect, so which is nothing but the structure undercover of gluteus maximus. So if you have already read that, then it will be easier. So this is the gluteus maximus. So what are the structure undercover of gluteus maximus? That is inferior to the piriformis. So piriformis is the key muscle of the gluteal region. Just below that we will be having the sciatic nerve, which is the thickest nerve in our body. Below that we are having the obturator internus with two gemellus, that is the superior inferior gemellus. Just inferior to that we are having the quadratus femoris, so which is supplied by the nerve to quadratus femoris. So this is the posterior relation of the hip joint. If we go to the superior, which is the structure under cover of gluteus maximus and above the level of piriformis. Okay, so again the gluteus maximus, medius, minimus, and the reflected head of rectus femoris. Okay, so in front this is the straight head of rectus femoris, so which is the anterior relation, and superiorly we are having the reflected head of rectus femoris. So coming to the anterior, as I already said, straight head of rectus femoris, then the tendon of iliopsoas. Okay, so these things forms the floor of the femoral triangle. I hope you remember. So here, this is the tendon of iliopsoas. So the whole joint capsule from there, the synovial bursa, which is extending, that is just below the iliopsoas, then which is in front the femoral nerve, femoral artery, and femoral vein. So these are the structure you must have appreciated in the femoral triangle and the pectineus. So these are the anterior relation. Coming to the inferior, inferiorly we are having the obturator externus, and here the medial circumflex femoral artery is running. Hope now this make the diagram bit simpler and easy for you to remember and understand the orientation of it. So coming to the factors stabilizing the hip joint, first thing is the acetabulum with its labrum. So as I already said, this is not only deepening the cavity of the acetabulum, and also it help in grasping, as it is a triangular fibrocartilage. It helps in grabbing the head of the femur, so which increases the stability. That's what it is meant to be, the narrow mouth. Then three strong ligament which is blended with the joint capsule, nothing but the ilio, ischio, and pubofemoral ligaments. And strength of the muscles, so the hamstring, quadriceps, and the adductor compartment muscle which is surrounding it, and the gluteal region also, which helps in holding the hip joint together. Length and obliquity of the neck of the femur, which helps mainly in the movement part, so that with this range of mobility the joint is more stable. Hip joint is supplied mainly by the medial and lateral circumflex femoral artery, which is a branch of profunda femoris, which in turn the branch of femoral artery. So this medial and lateral circumflex femoral artery encircles the neck of the femur, and from there we are retinacular branches. These are the retinacular branches. As I have already said, these retinacular branches enters into the neck just deep to the capsular ligament attachment, then supplies the most of the neck and the most of the head of the femur, and very the limited region of the head of the femur is supplied by the acetabular branch, which is the branch of obturator artery. In turn, it's a branch of internal iliac artery. So this acetabular branch passes into the ligament of head of femur and supplies the tip of the head of the femur, and these arteries like superior gluteal, inferior gluteal, which supplements the blood supply to the hip joint. So the blood supply to the hip joint is more important in the clinical aspect also, because the neck of the femur is tend to get fracture in old age due to the osteoporosis, especially in females. So because of that, the blood supply to the head of the femur will be impaired because of the damage to the retinacular vessels during the fracture of neck of femur, so which results in avascular necrosis. Nerve supply to the hip joint is received from the branch from the femoral nerve when it supplies the rectus femoris, and from the anterior division of obturator nerve, and the small twin from the nerve to quadratus femoris, and a branch from superior gluteal nerve, and again a small twig from the sciatic nerve. So because of the obturator nerve, which supplies both the hip joint and the knee joint, that is the posterior division will supply to the knee joint, anterior division will supply to the hip joint. Because of that, if there is any pathology in the knee joint, which may appear as a pain in the hip joint and vice versa. So this is the nerve which is responsible for the referring the knee pain to the hip joint and hip pain to the knee joint. Clinical anatomy of hip joint, that includes the fracture of neck of femur and its complication, that is the avascular necrosis of the head of the femur, which I have explained briefly in this video. Then other applied aspects like anastomosis around the hip joint, bursa around the hip joint, referred pain of hip joint, which I'm planning to make the few videos. So subscribe to our channel so that you won't miss those videos, and after making those I will give in the description. Thank you for watching.